extra, let's say, teaching opportunity you're giving the students in addition to their clinical rounds,
or
it's
extra? Yeah,
it's an extra thing.
Yes, it's extra. They're already going to formal clinical rounds in the wards and in the community, but in addition, it's like a bridge in between. It's in between clinical skills and the real life world of clinics and wards. Okay, so it's a safe and a supervised environment. You can go at your own pace. You're not constrained by clinical situations. So it's an additional thing.
Because actually we are using these logbooks, even in community medicine. We have it for some activities, and we leave it to the student, as you said, in their own time to go and fill it in.
Right. Okay.
And it has to be signed by whoever registrar was present at the time.
Yeah. Okay.
But
so they have some logbooks which help them through that.
Yes. So for you, it's like they come and register, and when you have a full list of students, then you bring in those patients.
Yeah. The students are timetabled to come to the Ambulatory Care Teaching Centre, so they'll come around in groups of 16 at any one time. Yeah, it's timetabled. During the 4 weeks of any one system, any one student would come round, I think, twice in that period. And they'd be going to clinical skills, they'd be going to wards, they'd be going to community as well.
Do you reward the patients?
Slightly. They get a hospital lunch, okay, and they get travelling expenses, okay, and they get a little party, maybe Christmas time. The dean puts on a little party, and they get a certificate to say thank you for being a. It's very inexpensive, but it's nice to get a certificate signed by the dean, say thank you for contributing to a patient teaching program. We're going to talk about logbooks now. Okay, so how can we help students learn in the ambulatory care teaching session? And the point is that we have to structure things so that they have every opportunity to learn as much as possible. So what instructional strategies are there? Well, there are all these, but we're particularly focusing on structured logbooks today. I brought you a couple of things to show you, but this is one logbook for use in an area of a peripheral hospital where there is lots of nurse-led activities. We want the students to record what they learned from the patients that they saw in all these nurse-led multi-professional activities. So this is like there's a nurse-led dermatology clinic, for instance, a nurse-led endoscopy procedures being carried out. There's a stoma therapist looking at people who have stoma and helping them in the management of that. There are various other people, speech therapists, physiotherapists, pain clinic management, all being done by other healthcare professionals. So there's a wealth of learning material, and students can document the different types of cases that they see in this logbook. And I'll show you the internal structure of the logbook shortly. There's a different type of logbook for use in the X-ray or endoscopy suite. We want students to really record patient histories or patient journeys, why different investigations were chosen to investigate their particular problem. And also I think it's interesting, we wanted to encourage them to learn how to write X-ray forms correctly, or all those management forms correctly. If there's one thing doctors seem to get into trouble about, it's not filling in X-ray forms right. They don't put all the information down that they should do. So this is all part of the structuring the students' learning. And then I mentioned that the day surgery unit and the patient journey, documenting preoperative assessment, the perioperative procedures, post-operative follow-up, post-operative care. So students can follow 3 or 4 patients in the course of a week through day surgery theatre and record their progress. This makes a very sort of powerful record book from the patient's perspective. And this is just how we use these 4 different logbooks. The blue one is for the clinics, I'll show you that eventually. How we use them in the peripheral hospital, and made it into a teaching event. Now, you mentioned task-based logbook, I think, where students had to record different tasks. And this is a very simple version of a type of logbook which you could use for this. A checklist, basically, of skills which students want to document to say that they've seen or participated in or become proficient at. So a record of clinical experience prescribed by the medical school. The logbooks I particularly want to go over now then are these. We have our outcome-based curriculum, 12 learning outcomes. These are the 12 learning outcomes of our curriculum, which are in those three groups: what the doctor is able to do, this is different competencies; how the doctor approaches their practice. This is all to do with knowledge and attitudes; and then the doctor as a professional. So these are the outcomes which we're wanting to teach to. What I've done is make I did rather some years ago now, is to make a logbook called Epitomise. And that word, epitomise, stands for those words, okay? Epitomise is, if something epitomises something, it stands for everything which is right about that particular thing, that topic. It stands for all those words there: inquiry, physical examination. I stands for investigation and interpretation of results. T, technical procedures. It's a little bit corny. O stands for options of diagnosis. That really means critical thinking and differential diagnosis. Management, information handling, that's IT skills. Sciences, basic and clinical sciences. And then education of the patient and education of yourself, or continuing professional development. So those words there actually map to the different parts of the 12 learning outcomes which are here. So now we've got a logbook which is useful because we can remember it, remember what it means, and we can use it to write in. So in a clinic, or in a nurse-led activity, multi-professional activity, wherever students see a core clinical problem or an interesting clinical problem, they can write down where they saw it, what it was, and what did they learn under each of those headings. So they might, for instance, have learned something about key questions to ask, or key parts of a physical examination that they didn't know of before. They may have been able to relate it backwards to some basic anatomy or some basic sciences or pathology. And we write down, and then we ask them to say, well, what did you think about that? And we want them to write down here, what learning needs did you identify? Okay, I'd forgotten the surface markings of the lung. Okay, so what did you do about that? How did you address this learning need? In the next box down. And then what did you learn in addition? So we're probing a little bit further here, trying to measure or document or stimulate the students to learn more, having reflected on the clinical encounter they've just had. So here's an example, okay? I don't know if you can read it very much. It's a big screen, I think you can possibly read it. Fortunately it was a girl, she's got nice handwriting, so it's easy to read. So this is a patient. It says patient problem, pain in the knee, and it's a meniscal tear. Okay, so she's inquired about that, checking that there is peripheral circulation and sensation. For physical examination, for ethics, she's talked about informed consent prior to surgery. What was the imaging that was used? She's mentioned a plain X-ray and MRI scan on arthroscopy. The technique of treatment, she saw the thing injected with local anesthetic and aspirated. And then further down, she's learned about anatomy and the shape of the meniscus, mechanism of tearing the meniscus and referred pain, etc. On this other side, she learned what are her learning needs. She says she needs to think about the anatomy of the knee joint a bit more. She wants to think about the post-operative complications of a meniscectomy, and she's looked at these things by observing arthroscopic surgery, I guess on the web, or maybe in another surgical situation. And very significantly, you see at the end, what more did you learn as a result? Swelling the knee could be due to pus or blood or synovial fluid in the joint. And what's the failure if you have an ACL repair? So she's really looked at what she saw, reflected on it, and then gone away and learned more and more things. So this is one good thing about a structured logbook, which is directing the student really to do their own learning, to get in charge of their own learning wherever they are. So this is why I think that structured logbooks are a good thing to encourage student learning in different places. Now, Moira Maley is a colleague in the University of Western Australia in the Rural Clinical School, and she and I looked at two logging approaches, and this is in conclusion and the last part of the material I wanted to share with you this afternoon. And it was just to look at this. Mine is a paper-based approach, as you can see. You've seen an example of it. I'll put out a book here for you. Okay, this is an example of the logbook. And it is intent on focusing learning outcomes, and we used it in year 2 and we use it in the higher year to direct clinical experiences. Moira in University of Western Australia Rural Clinical School has a very high-tech, web-based approach. It's on the web. It's an electronic logbook. It's used in their final year. It covers scientific basis of medicine, the doctor, the health and the society, doctors and patients, continuing professional development. The same sort of outcomes as the 12 learning outcomes which we have in Scotland. And implicitly it's the same as the content is the same as the epitomise. It focuses student learning, identifies learning needs, etc. Advantages of this electronic logbook is, of course, it's portable. Students can search it anywhere. It can be audited. The medical school can look at it simultaneously to the student filling it in and know what the students are doing and learning while they're away. This is very important in Western Australia, which is an enormous country, and students are some thousands of miles away from the tertiary referral centre, the teaching hospital. The teaching hospital is in Perth, and people are way up the eastern coast of western coast of Australia, some 2,000 miles away. So it's a big distance, and this is they keep in touch electronically. This is just a picture to show you some of the. Yeah, here we are. Here's Perth in Western Australia, and they have students all the way up in all these places, right up here, Boone and Derby in the far north. On my scale of things, if I'm here in Dundee, this is like having students in Barcelona in Spain, being run from Dundee, and I guess here you might be able to work out similar distances. Okay. The point about it is the logbook in the Rural Clinical School of Western Australia is envisaged as a lifelong learning portfolio. It acts as a basis for the student to reflect on their learning and discuss it with their mentor, their medical education coordinator, while they're away from the university centre, and it helps them spot any gaps in their learning. Well, how useful was the book? Okay, here's a tiny trial which I started, which is ongoing at the moment, so the numbers are larger. 63% of senior students thought that the book was useful. This is a paper-based book which costs next to nothing to produce. And in Moira's case, using the electronic logbook, student opinion was there, as it says there, in the Rural Clinical School. Okay, so they thought it was useful. Did they think it was enjoyable? Not quite so much. 29%, only 29% thought it was enjoyable. So it was a little bit of a trial for them, perhaps a little bit constraining, and they were reluctant to say that they enjoyed it, but they did say it was useful. And they also said it helped them learn or think more about the 12 learning outcomes. So 74% said it did that for them. Now the point about this is that that's important, because if you're teaching in an outcome-based curriculum, then that is your curriculum, and you want to see that students have learned in all those 12 topics. And so if any one patient encounter helps students to think about a variety of learning outcomes, then it is scoring very highly. And I think this is the message which, if you like, I want to share with you, because this really helps students learn the breadth of material presented by that one patient. Maybe not all 12 learning outcomes from one patient, but certainly a good whack of them. And it's these things which we forget to teach. We may forget to teach ethics. You see, you're talking about surgery on a patient because it's exciting and interesting, but we don't often talk about informed consent and how much we have to make sure that the patient knows what they're signing up for. And often we're perhaps a bit light on patient education, what they should know before they go home, who's going to look after them. So there are all sorts of things, and we can make that spread quite explicit by using a logbook in these cases. And 74% of students realise that. Did it help me identify new learning needs? When we run it by junior students, it was about the same. 49% of junior students said that, and when of the older cohort, 49%, so half and half, but it helped them identify learning needs. So in the sort of conclusion about this, the paper-based version is like that. Simple to implement, relatively low cost, not reusable of course, low tech. An e-log is more complex, requires some help, requires high-tech input, but their impact of both these approaches is very similar on students. So I think that was my message in this short meeting. Except just finally to say that to help clinicians teach in other places, we may need to give them material, and I brought an example of an advert rather of material which we produced recently to help clinicians teach in different places. Colleagues who've been helping in this work are here, two from Dundee and Denise Paper from Australia. So thank you for your interest, and please keep in touch.
My question is, how useful, because a lot of universities, a lot of medical schools have logbooks, but not as structured. Just contain the procedure or the skills they want the student to see, observe, or do,
yes,
or
just
the
a
skillful act,
list, yeah.
and then signature of the supervisor.
Yeah.
That's all.
Yeah.
Nothing required on the part of the student to comment on and follow the verbal account of it. But how useful is it, or how practical in large number of students and big groups, because if it's not done properly, it's not looked at, it's not acted upon.
Sure.
How is it?
Yeah. This is the problem. Of course, the more the things you create, the more you end up having to look at or assess. And if you imagine these filled in like the example I showed you, there's quite a lot of material there. Now we hope that it isn't just one person who's doing the assessment for all the students, because if you have a group of students with you in your discipline or in your particular clinic, then with some staff development help, your colleagues should be able to assess students by glancing through that sort of record. The virtue of this record is it documents definitely what students say they've done and learned, whereas without that you're left with a subjective opinion of whether the student was any good or not any good, and maybe they just get a tick on a sheet to say that. The problem I think with the tick box for the task lists which you mentioned is it doesn't mean anything. It just means they saw, there's like had a plaster put on, competent to put on plaster of Paris, and students will come along and say, I saw you put on a plaster of Paris cast, can you sign my logbook? Because I saw it. Well, that doesn't really mean anything, and you have to have a much more structured book for those tasks to demonstrate competence and progression of competence. And I think those could be altered quite a bit. The University of Otago there in New Zealand had a very good book which was much more structured for tasks, so that you could see students progressing the more times that they had that book presented for signing. So I think there's two answers there, that try and diversify the number of people who are doing the assessment and the marking of this book here, and for the task-based book to spread out not just one tick box but several boxes, so that there are several grades of competence recorded.
Okay, other comment please.
I think it's a launching.
It's a launching, it's a bridge between clinical skills training and real-life hospital clinics and wards. So these are young students who go through that program. They're second or third year students. This acts as a bridge between practicing in simulation on plastic models and simulated patients at the Clinical Skills Centre and going to the real life ward where things are busy. Now, because they're junior students, they are also going to the wards and to community practices, but those are again constructed situations. They're not really in the rough and tumble of a big clinic like clinicians are. So the ACTC acts as a bridge between simulated protected environment to the real life environment. But the virtue of it is its real patients.
Yes, please.
More about the point raised by Professor Yad.
Yes.
And really, because that's the concern in Khartoum University, specifically the large number of students.
Yes.
And using such a logbook, and the colleague who has the electronic version, and using medical informatics, is there any place to put keywords?
Yes, okay.
And then search for them automatically, and then leave the scrutiny for only that last question, for example, of what you learned more.
Yeah, the logbook, the electronic logbook, which my colleague Maura Bailey has designed and was using, is searchable by keywords, so the students can search for different topics, different conditions. It's possible for the medical school to know what cases they've seen and what they haven't seen. So if they're remote from the centre, you know that they haven't yet seen postmenopausal bleeding or some such thing. So they can be directed to find that sort of case if they haven't seen it yet. So that's useful in that way for making sure the students see the right things.
But even when they feel, for example, they have seen this surgery.
Yeah. The electronic logbook is then used by the regional medical coordinator to inform a discussion with the student. So they would take the logbook, and that would be the basis of their discussion as part of that sort of loop of teaching and learning. The students see a patient, they document them, they reflect on it, and then the medical coordinator at the end of their block would have a discussion with them on their logbook. But that's diversified. That point is, it's diversified the teaching to many other people, and not all to yourself in the centre. And I think that's really what it's all about, to try and engage more people. And if you make it usable and meaningful for them, I think it's easier to engage the help of other colleagues. But it does need staff development.
CTC, financial hardship. Because obviously you need a good setup, to make all these fancy.
Okay. Yes. Okay. And an ACTC is of value, I think, in your medical school setting, because you can provide a different venue. In a rural setting where there are already healthcare delivery venues in place, I don't think you need an ACTC there, because there's already other opportunities for learning. But in the teaching hospital, an ACTC helps to augment your program here and diversifies the type of learning which the students can be engaged in. So I wouldn't want to set one up in a remote peripheral site. That wouldn't be particularly required.
Omar, yes.
Okay, at the end, I think you have applied on behalf of the EDC, would like to thank for them for this interesting lecture. I think the message for me is very clear, that we have to change the way we are doing the logbook from a means of just for the student checking to a means of a process of learning, to be a useful thing. That you have today you have the lecture about the domains of learning, the psychomotor domain, the affective domains. All this can be achieved if we really going to structure our logbook in a different way, not just a checking book for an examination, to sit for the examination or not to sit for the exam. Is he attending or not? I think this is really a new task for us to understand the meaning of a logbook, which has to be approached in a different way. Some you know that you have a tight schedule, and you have come to us in between a break, and that we are very grateful for.
Thank you for your invitation. Thank you very much. Thank you again.
By the way, this is the University of the